Hello, everyone, and thank you so much for joining us today for the Wichita Vision Institute LASIK webinar. My name is Josh, and I'll be moderating for you guys today. You'll notice on the right-hand side, you'll see the Go To Webinar menu there. In that area, you'll see a tab that's called Questions. If you guys have any questions throughout the webinar, please feel free to go ahead and add those questions in there, and we'll go ahead and take care of those questions at the end of the presentation here. And so I would like to introduce Dr. Reena Patel, the founder of Wichita Vision Institute. She's been in practice in the Wichita area for over 16 years, specializing in LASIK surgery. So just a little bit of background information on Dr. Patel. She completed her medical school in the University of Nebraska Medical Center. She trained at the Mayo Clinic and Tulane University, and then completed a fellowship at the Dean McGee Eye Institute at University of Oklahoma, specializing in cornea and laser vision correction. Following that, she then established Wichita Vision Institute in 2004. So without further ado, here is Dr. Patel. And like I said, if you have any questions during the webinar here, feel free to type those in the questions tab on the right, and we'll answer those at the end of the presentation. Over to you, Dr. Patel.
Thanks so much, Josh. As Josh mentioned, I'm Dr. Reena Patel, and I want to thank you so much for joining us today on a busy Friday to learn more about LASIK. TGIF, so happy that it is Friday, and that we get to talk about one of my favorite topics, which is LASIK. I had my own LASIK surgery November 18th, 1999, and truly it changed my life. I was able to go from not being able to see the big E to seeing better than 20/20. My LASIK surgery inspired me not only because my vision was fabulous, but it wanted me to allow others to have the same opportunity I had. So it guided me to become a cornea specialist. All of us love to see clearly and naturally, and deciding to have LASIK is a huge decision. Research shows that it ranks up there with some of the top 5 life-changing events, such as having a child, getting married, and we all want to know the basics of this to see if we could have this life-changing surgery. How does LASIK work? Does it hurt? How safe is it? And can I afford LASIK? Those are usually the top questions patients like to ask me, and we'll discuss those during our webinar today. But first, let's talk about some common vision problems. If you're watching this webinar, you most likely have some sort of vision problem, and that's the reason that you're interested in LASIK surgery. So you may be nearsighted, farsighted, and or have astigmatism. So if we look at our diagram, we have light that goes through the cornea. It's focused on the lens and onto a retina. When you're nearsighted, think of your eye like a ping pong ball. Instead of being a ping pong ball, it's more like an egg. So that light is not able to shine and hit the back of the retina without glasses or contact lenses. So you need glasses to be able to see far away. With farsightedness, it's the opposite. It's like that ping pong ball is actually smushed and your eye is shorter than normal. So your eye is not powerful enough to bring light to focus the retina, and so you need glasses to be able to see up close. And astigmatism occurs when your cornea, instead of being round like a basketball, is more like a football. So when light goes through your eye, instead of having one ray, you have multiple rays. It's the same reason that if you squint your eyes, you're able to see better, because your football-shaped cornea now is more like a basketball, and light is able to focus on the retina. So when we're talking about laser vision correction, there are a couple different procedures that are included under that umbrella term. The first is traditional LASIK, and that's where we're making a flap in the cornea or the clear part of the eye with a blade. There is all laser LASIK, which is really what we do now, and that's where we make a flap in the cornea with a femtosecond laser, and this allows us to make a thinner flap and have more accurate results. We then change the shape of the cornea with another laser, and we put that flap back. There's also something called PRK, or photorefractive keratectomy, and with that laser treatment, we don't make a flap at all. We actually treat the surface after we've removed the surface and reshape the cornea there. So really how LASIK works. LASIK actually changes the shape of your eye so that light can hit the back of the cornea. The way that we're able to do this really accurately now compared to when I had surgery over 20 years ago is by using eye design technology. What eye design technology is basically we take a specialized picture of your eye and we get 1,256 data points, which accurately map out your eye. So think of it as a fingerprint of your eye. Each eye has its own unique fingerprint, and what we do with this image then is place that into the laser to create a customized wavefront treatment for you. So what does that mean? That means even better technology and better treatment and vision for your eyes. So no two eyes are alike, just like our fingerprints. And so that's why we want to be able to treat exactly what you have. Depending on your lifestyle, what you like to do, what your eye health is, everybody has a different treatment formula. So it's not that one surgery solves everybody's problems, but we customize it based on each one of your eyes so that you're able to see and do what you'd like to do. So better technology means better outcomes and happier patients. So when we perform LASIK surgery, there are 3 steps. When you come into our office for surgery, you're going to get some Valium so that you're nice and relaxed for the surgery. We put in numbing drops in the eye, and then we put a little retractor in the eye to keep the eye open so that you don't have to worry about blinking during surgery. We make a flap in the cornea that's partial thickness, and that's the clear covering of the eye. It takes about 13 seconds to do, and then we lift that flap up. Afterwards, we use another laser, which is called the Vizx S4 laser, to reshape the corneal tissue so that light can hit the back of the retina, and then we replace the flap back. Surgery takes 5 to 7 minutes an eye, and it's done in our specially designed laser suite. Afterwards, then we take you to a post-op area. We let you rest your eyes for a few minutes, make sure that your flaps are looking good, and then let you go home to take a nap. I believe that technology makes a big difference when you are having your surgery. The surgery that I had 21 years ago is much different than the surgery that they had in 1985, which is when LASIK was first approved by the FDA, and it's different than what we have now. I believe that the technology that Wichita Vision Institute offers patients is the best in terms of allowing you to see the best that you can. With the technology that we have now and using eye design wavefront technology as well as our IFS and STAR S4 lasers, we're able to offer patients a chance of 20/20 or better vision over 97% of the time. And that's with the FDA treatment guidelines and their initial studies. So when you're looking at surgery, not only is the technology important, but having the right surgeon is important. You want to have someone that's done thousands of surgeries and specializes in laser vision correction. You want to have someone that is up to date with the most advanced technology and offers you that technology because it does make a difference in terms of your vision. You only have one set of eyes, so you want to make sure that you feel comfortable with your surgeon and that you have someone that's been on both sides of the procedure itself. Having had LASIK, I know how patients have felt post-op because I was one of those patients. So my job is basically to help guide you through the process from step 1 of your consultation to your preoperative exam, to your surgery, to your postoperative care. I think something unique that we have at our facility is that you are going to be seeing me the entire time. And I am going to hold your hand through the process to make sure you do well so that you're happy with your vision. There are a lot of questions that patients like to ask. What are the risks? With any surgical procedure, there's always a risk involved with surgery. But the good news is that LASIK is actually safer than wearing contact lenses. More people lose vision to overwearing their contacts or having issues with dryness as opposed to LASIK surgery. There are always risks involved with surgery, and we know that patients will be more dry post-surgery for a year because of the flap that they have, and it takes a year for the nerves to grow back into place. At night, initially right after surgery, you're going to notice some halos and starbursting because of the dryness. If we don't adequately treat your dryness prior to surgery, you can have over or under correction. You can have glasses or contact lenses after surgery, which is why we want to aggressively treat any of your eye conditions prior to surgery. And there's the risk of infection or your flap moving if you rub your eye after surgery. The good news is that most complications are extremely rare. Patients always want to know, can I really get rid of my glasses? I was 26 years old when I last wore glasses for distance vision, and I've been out 21 years now post-surgery. Really, if you are between the ages of 18 and 45, you should not need any glasses or contact lenses after surgery. What happens when you hit your 40s, unfortunately though, is that the lens that normally allows you to see up close becomes a little less flexible. And slowly over time, that flexibility continues to decrease. And so all of a sudden, you'll see that you are starting to have to hold your phone out a little bit further, bump your font size up, and reading glasses may occur. Unfortunately, LASIK can't stop your eyes from aging. That would be great, but it's not the case. And so reading glasses will be needed once you hit your mid-40s. However, there is a LASIK procedure called monovision LASIK, which some patients will choose to do, and that's where you have your dominant eye corrected for distance and your non-dominant eye for near. So then if you would prefer not to wear reading glasses, that is something that can be done to help minimize the use of readers. Does LASIK hurt? Honestly, you feel a little bit of pressure during LASIK surgery, but I felt no pain. Most patients will say that their eyes are a little bit scratchy or gritty, and they feel like they have an old contact lens in them, or the eyes feel like they do after you've pulled an all-nighter. But you don't have a lot of pain. We give patients ibuprofen when they're here, and they may or may not take some ibuprofen the evening of surgery, but really no pain medications are involved. Usually we'll do surgery on a Tuesday, and we'll see patients back Wednesday, and they're able to go back to work Thursday. What's great is most patients are able to drive themselves back after their LASIK surgery, as long as they're not high on the Valium and they feel comfortable with their vision. Usually about 90% of patients are actually even able to drive the next day after surgery for their appointment. So let's talk about what makes you a candidate. Normally, we want you to be at least 18 years old because that's what the FDA guidelines are. We want you to be in overall good health, and we want your prescription to be stable for at least a year. If we are considering performing permanent vision correction, we want to make sure that your prescription is not changing every other year. In addition, we want to make sure you don't have any other eye diseases and that you're not currently pregnant and have stopped breastfeeding because hormonal changes can cause vision changes. When someone comes in, though, not everybody is a candidate for surgery. I'm picky about the patients that I say yes to because if you are not a good candidate, unfortunately, LASIK is not magic. It can't fix all ocular problems, but we want to make sure that you are a good candidate so that you do well with surgery. So the best way to find out if you are a candidate for surgery is to come in for a free LASIK consultation. At that consultation, you will see me. You won't see another doctor or an optometrist, and we would want you to stay out of your contacts if they're soft lenses for at least 2 weeks and your hard or toric lenses for at least 4 weeks. The reason for this is that your contact lenses change the shape of your eye, and we want to have these contacts out so we can see what the natural shape of your eye is and to determine your candidacy. Because if you have some irregularities in your cornea, that could affect whether you are a good candidate or not. When you come in, there's no pressure for you to have surgery. You're coming in because you're interested in surgery as opposed to us trying to pressure you into surgery. I don't like being pressured when I go to buy a car or go to other shops, and I would definitely never do that to you because this is a big decision and we want you to make the right decision for you. And there are financing options available, and honestly, LASIK can save you money in the long run. For me, it took about 4 years to pay off my LASIK, depending on how often you wear contact lenses, how much you spend on glasses, and how often your prescription changes. This actually is more of an investment in your vision. So what can you expect? If you are a candidate and come in for your consultation, then we perform a separate second exam, which is called a preoperative examination. During that time, we'll repeat what we've done in terms of measurements, make sure your eyes, if we've treated anything in the past, are doing better, and dilate you to take a look at the back of your eyes, and also check your prescription dilated so that you're not able to squint, so we get your true prescription. We will want you to be out of your contacts for about 4 weeks for that examination, so then that way we can take the measurements that we need for surgery. And on surgery day, normally we'll have you come in. We won't want you to wear any makeup or perfume, and we'll want you to wear warm, comfortable clothing because the laser room operates at a colder temperature than normal. Obviously, we wouldn't want you to drive because you would be on Valium and you'll just have had eye surgery, and we'll want you out of your contacts for a month. When you come in for surgery, that visit takes approximately 2 hours because we have consent forms that we need to sign. We're going to recheck our measurements because it's always better to measure twice, cut once, give you some Valium so you're nice and relaxed for your surgery, put in numbing drops so the eyes are ready for surgery, and the treatment itself takes about 20 minutes or so. And then we'll have you rest in our post-op area, check your eyes a couple of times, and then let you go home that day. After surgery, we'll want you to take a nice nap. You'll be on some preservative-free tears, and you'll use some antibiotic and steroid drops. We'll have you wear shields at night for a week because we don't want you to accidentally rub your eyes, and we won't want direct water in your eyes. Rubbing the eyes is a big no-no post-surgery because we want your flaps to heal properly and for you to see well. Then normally we'll see you the day after surgery, about a month after surgery, a week after surgery, a month after surgery, 6 months, and a year. We want to make sure that your dryness is getting better, that your vision is good, and that you've been healing well. And Josh, I'm going to hand it back over to you.
Well, thank you, Dr. Patel. That was awesome. And I don't see any questions currently here on the chat function, but I'll talk for just a minute here and let anybody get a chance to add any questions that they may have into that question area. While we're waiting on that, I do want to cover a post-webinar special that will be available out for you guys here. Everybody that is here with us today will reach out with an email after this and give you the opportunity to schedule the free consultation that Dr. Patel was mentioning. But we are offering $200 off for each eye for all webinar attendees. And so that's $200 off per eye, so a total of $400 if you're doing a bilateral procedure, essentially having LASIK on both eyes. This cannot be combined with any other offers, and some restrictions may apply. We do ask that you schedule that free LASIK consultation by February 28th. Here with us, and you can do that by giving a call to the number that you see on the screen there. You can also find that on our website here. But we do look forward to seeing you all, and if you have any questions, rest assured during that consultation there is time allotted to make sure that we answer those questions one-on-one with you and make sure that everything that you have questions about is answered thoroughly before you would ever move forward with a procedure. So Dr. Patel, I don't see any questions, which makes me think that you just did a splendid job, I believe. Let me double check here. Well, I do see one. Is there a discount for paying for the surgery outright rather than financing? That would be the question that I have out for you guys.
There is a cash discount available for patients. Normally, the procedure is paid the day of surgery, and so yes, there is a cash discount available for patients if they opt to pay for it all at once as opposed to financing.
Awesome. And then I do have another question here that is, after doing the consultation, how long till I can get the actual procedure? Already have the consultation scheduled for February 4th.
If you've been out of your contact lenses and stay out of your contact lenses, it would be potentially based on how the surface of their eyes looked and if we needed to treat anything at that time during the consultation. So normally, if you are a candidate and depending on when you want to have surgery, we can organize that so it could be a few weeks post-surgery. So there's not a huge delay. Normally when patients decide they want to have LASIK, they want to have it yesterday. And so they want to get things forward because they're excited with their decision. And once they find out they're a candidate, I get asked like, hey, what are you doing tomorrow? Usually it's not quite that quick, but we would be able to do that within a few weeks, most likely.
Awesome. So the glasses are getting very heavy, LOL.
Yes, I understand.
I'll throw one out to you, Dr. Patel. This is just for me specifically, but I know, after LASIK, on coming in for that first day post-op, and you have that clear vision that, a lot of folks haven't had, really for their whole lives, having glasses through middle school and high school. For you, what was the thing that, when you were post-LASIK that really, brought your new vision home? That was, was it the leaves on the trees, being able to drive in and see license plate numbers? What for you was like the, oh my gosh moment after you have LASIK?
Seeing my alarm clock. I'm not what you call a morning person, so I normally have to have an alarm clock next to my bed and then on my dresser far away, so I physically have to get up to turn it off, and I could never see it without putting my glasses on. I think that, and then being able to shave my legs in the shower and actually see the hair on my legs, that was pretty amazing. Most people don't realize if they don't wear glasses and contacts, what a pain that can be, and you take it for granted. And I can tell you that was a game changer too.
Yes, I have clear vision myself, and that's, I think, one of the things, even something as simple as seeing the difference in the shampoo and conditioner bottles when you wake up in the morning
absolutely.
and get the shower.
For sure.
And so we just had a couple of questions come through, just touching on what about having an astigmatism in both eyes? Does that typically affect candidacy or LASIK outcomes?
Well, we can definitely treat the astigmatism, and we want to look at the astigmatism to make sure it's a regular pattern. So that's why we want you out of your lenses. So the longer you're out of lenses, the more that we can tell what your natural astigmatism pattern is. But we can treat quite a bit of astigmatism. That's one of the other advances that we've had compared to surgery back when I had it 21 years ago. I was still doing surgery at that time, but we were not able to treat nearly as many patients as we can now. So that's the beauty of technology advancing, is that we're able to offer the surgery safely and have great results from treating that astigmatism now.
Awesome. And then just another question that came through here, pretty sure I know the answer to this one, but I'll still pass it over to you, is I wear glasses, not contacts. Does that mean I'm not able to have this surgery? So,
oh, no, not at all. Yeah, absolutely. Absolutely, you could have surgery.
And then another question here, does how bad your vision is affect your qualifications? So, a severe prescription or a prescription on the less visual acuity side.
So depending on your prescription, you have to have enough corneal thickness to be able to do the surgery safely. So when you come in, we'll actually measure that corneal thickness. The nice thing about the technology being more advanced is that nowadays for the same prescription, let's say you're a -8. If you had thinner corneas 20 years ago, we may not have been able to do the surgery, whereas now we're able to offer the same treatment of that -8, but not affect as much tissue, so that more patients are actually candidates because of the advancements in technology.
Perfect. And I think that wraps up the questions I have here for the webinar. So everybody, thank you so much for attending. Feel free to call the phone number you see on the screen here. We'll also be reaching out to you, and we certainly hope to meet you soon and see if you are a candidate for LASIK. And Dr. Patel, thank you for your time today. That was fantastic.
Yes, no, I thank everyone, and have a great weekend. Appreciate your time.
Take care, everyone.
Bye-bye.